The pain started during lunch break at work. Keisha Morrison sat at her desk, staring at her computer screen, trying to focus on the lines of code in front of her. But the sharp stabbing sensation in her lower abdomen made it impossible to concentrate. She pressed her hand against her side and took a deep breath. This was different from her usual endometriosis pain. This felt wrong. This felt dangerous. Keisha had lived with endometriosis for nearly 10 years. She knew her body. She knew the difference between her normal pain and something serious. This was something serious. She called her husband James. Her voice shook as she spoke. "I need to go to the emergency room. Can you meet me there?" James heard the fear in her wife's voice. "I'm leaving work right now." "Which hospital?" "St. Catherine's Medical Center. It's closest to my office." Keisha grabbed her purse with trembling hands. "Please hurry." The drive to the hospital took 15 minutes, but it felt like hours. Every bump in the road sent fresh waves of pain through her body. Keisha gripped the steering wheel, fighting to stay focused. She parked in the emergency room lot and walked slowly toward the entrance, one hand pressed against her abdomen. Inside, the emergency room was busy but not crowded. Several people sat in the waiting area. A man held an ice pack against his hand. A mother comforted a crying child. Keisha approached the registration desk. "I need help," she said to the woman behind the glass. "I'm having severe abdominal pain." The receptionist handed her a clipboard with forms. "Fill these out and have a seat. Someone will call you." Keisha completed the paperwork, her hands shaking as she wrote. She included her complete medical history, making sure to note her endometriosis and previous ovarian cysts. She knew this information was important. 20 minutes later, a nurse called her name. Keisha stood up carefully and followed the nurse through the double doors. They went to a small examination room where the nurse took her vital signs. "Your blood pressure is a bit high," the nurse said, wrapping up the blood pressure cuff. "Are you normally anxious?" "I'm in pain," Keisha replied. "Severe pain. I have endometriosis and this feels different from my usual symptoms." The nurse typed notes into the computer. "The doctor will be with you shortly." Keisha sat on the examination table, her designer work clothes now wrinkled from the drive. She had dressed professionally that morning for an important meeting. Now she sat in an emergency room, desperately hoping someone would help her. James burst through the door 10 minutes later. "Baby, are you okay?" He rushed to her side and took her hand. "I'm scared," Keisha admitted. "Something is really wrong." They waited together. 30 minutes passed, then 40. Keisha's pain grew worse. She doubled over, gripping James's hand so tightly her knuckles turned white. Finally, a doctor entered the room. Dr. Marcus Webb was a white man in his early 50s with gray hair and tired eyes. He wore a white coat with his name embroidered on the pocket. He glanced at Keisha and then at the computer screen, barely making eye contact. "Ms. Morrison," he said, his voice flat, "what brings you in today?" "I'm having severe abdominal pain," Keisha explained, speaking quickly despite her discomfort. "I have endometriosis and I've had ovarian cysts before. This pain is different. It's sharp and constant, and it's getting worse. I'm really worried that something might be ruptured or—" Dr. Webb held up his hand, cutting her off. "How long have you had this pain?" "It started about 3 hours ago during my lunch break. It's been getting progressively worse." "On a scale of 1 to 10, how would you rate your pain?" Dr. Webb still hadn't looked directly at her. His eyes remained on the computer screen. "It's an 8. Maybe a 9 now." "Doctor, I really think— Have you taken anything for the pain?" Dr. Webb interrupted again. "Just some ibuprofen I had in my desk at work. It didn't help at all." Dr. Webb typed something into the computer. Then he stood up and walked toward Keisha. He pressed his hand against her abdomen for perhaps 10 seconds, pushing in different spots. Keisha winced and cried out when he pressed on her right side. "That really hurts," she gasped. Dr. Webb stepped back. He didn't order any blood tests. He didn't order any imaging. He didn't ask about her medical history beyond what she had volunteered. He looked at Keisha with an expression she couldn't quite read, something between annoyance and suspicion. "Ms. Morrison, I think you're experiencing some discomfort from your existing condition," Dr. Webb said. "There's no evidence of anything acute here." Keisha stared at him in disbelief. "But you barely examined me. Shouldn't you do an ultrasound or blood work? When I had a cyst before they—" "I've been practicing medicine for 25 years, Dr. Webb said, his voice sharp. "I know how to assess a patient. What you're describing sounds like you're seeking pain medication." The words hit Keisha like a slap. "Excuse me? I'm not seeking drugs. I'm in serious pain. Something is wrong with my body and I need help." James stood up from his chair, anger flashing across his face. "Doctor, my wife has never asked for pain medication. She's a successful software engineer. She has a medical condition and she's asking for proper care." Dr. Webb's expression hardened. "Sir, I'm going to have to ask you to calm down. I've made my medical assessment. Your wife is experiencing discomfort, but there's nothing here that requires emergency intervention. Can you at least run some tests?" Keisha pleaded. "Please, I know my body. Something is very wrong." Dr. Webb was already typing on the computer. "I'm prescribing some standard pain medication. If the pain doesn't improve in a few days, follow up with your primary care physician or your gynecologist." "A few days?" Keisha's voice rose. "I'm telling you, this is an emergency. If you continue to insist on unnecessary tests and medications, I'll have to note in your chart that you're demonstrating drug-seeking behavior," Dr. Webb said coldly. He ripped a prescription from a pad and handed it to James. "This should help with the discomfort. You can fill this at any pharmacy." Keisha felt tears burning in her eyes. She looked at the nurse who had taken her vitals earlier. The young woman, whose name tag read Sarah Chen, stood near the doorway. Sarah's face showed discomfort, but she said nothing. "This isn't right," Keisha said, her voice breaking. "You're not listening to me. You're not helping me." "Ma'am, this is a busy emergency room," Dr. Webb said. "We need to reserve our resources for actual emergencies. You're going to be fine. Go home and rest." He left the room without another word. Sarah Chen lingered for a moment, looking like she wanted to say something. But then she too disappeared through the door. Keisha sat on the examination table, tears streaming down her face. James put his arm around her shoulders. "This is wrong," he said quietly. "This is so wrong." "He didn't believe me," Keisha whispered. "He didn't even try to help me. He looked at me and decided I was lying." "We should go to another hospital," James said. Keisha shook her head. "I'm so tired. Maybe he's right. Maybe I'm overreacting." Even as she said the words, she didn't believe them. The pain was real. The fear was real. But the doctor's dismissal had planted a seed of doubt in her mind. They left St. Catherine's Medical Center together, walking slowly to the parking lot. Keisha climbed into the passenger seat of James's car, still clutching her abdomen. The prescription paper sat crumpled in James's pocket, forgotten. As they drove away from the hospital, Keisha stared out the window. She had come seeking help and left feeling humiliated and scared. Somewhere in the back of her mind, she understood what had happened. She had been dismissed not because she was wrong about her pain, but because Dr. Webb had looked at her brown skin and made assumptions. He had seen a black woman complaining of pain and immediately doubted her. The pain continued to grow worse as they drove home. Keisha closed her eyes and prayed she would make it through the night. She had no idea that her nightmare was only beginning, and that Dr. Marcus Webb's 3 minutes of prejudiced indifference would nearly cost her life. Keisha made it home and went straight to bed. James helped her change into comfortable clothes and brought her water and the pain medication Dr. Webb had prescribed. She took the pills hoping they would help. They didn't. The evening passed slowly. Keisha tried to watch television but couldn't focus. The pain kept building, wave after wave. She shifted positions constantly, trying to find any relief. Nothing worked. "Maybe we should go back to the hospital," James said around 8 o'clock. He sat on the edge of the bed watching his wife with growing concern. "No," Keisha said firmly. "That doctor made it clear he thinks I'm faking. I'm not going back there to be humiliated again. Then we go to a different hospital. Let's just wait a little longer. Maybe the medication needs more time to work." Keisha didn't believe her own words, but the shame of being called a drug seeker still burned fresh in her mind. She couldn't face walking into another emergency room and having doctors think the same thing. By 10 o'clock, Keisha was having trouble staying awake. The pain had become so intense that her body was shutting down. She felt dizzy and cold. Her skin was covered in sweat. "Baby, I'm really scared," she whispered to James. James looked at his wife and felt his heart clench with fear. She looked terrible. Her normally warm brown skin had turned gray. Her eyes were unfocused. "We're going to the hospital right now," he said, reaching for his phone. "Just let me sleep a little," Keisha mumbled. Her words were slurred. "So tired. Keisha, stay awake." "Talk to me." James shook her shoulder gently. She didn't respond. Her eyes had closed. Panic flooded through James. He dialed 911, his hands shaking so badly he almost dropped the phone. What's your emergency? My wife is unconscious. She was in severe pain and now she won't wake up. Please send an ambulance right away. The dispatcher asked questions. James answered as best he could while trying to wake Keisha. He gave their address. He explained about the pain, about the visit to St. Catherine's earlier that day, about how much worse things had gotten. The ambulance is on the way, the dispatcher said. Stay on the line with me. The next few minutes felt like hours. James kept talking to Keisha, begging her to open her eyes. Finally, he heard sirens outside. He ran to open the front door. 2 paramedics rushed inside with their equipment. A woman with dark hair knelt beside the bed and began checking Keisha's vital signs while her partner asked James questions. Blood pressure is dangerously low, the woman said. Heart rate is elevated. We need to move now. They loaded Keisha onto a stretcher and carried her to the ambulance. James followed, climbing into the back beside his unconscious wife. The female paramedic started an IV while her partner drove with lights and sirens blaring. Which hospital are we going to? James asked. University Hospital. They have the best emergency department in the area. James thought about St. Catherine's Medical Center, just 10 minutes from their house. University Hospital was across town, at least 20 minutes away. But after what happened earlier, he was grateful they were going somewhere else. In the back of the ambulance, the paramedic worked quickly. She spoke into her radio, giving information to the hospital. James caught phrases like acute abdomen and possible internal bleeding and potential sepsis. Each word terrified him. Is she going to be okay? He asked. The paramedic looked at him with kind eyes. We're doing everything we can. The doctors at University Hospital are excellent. They'll take good care of her. The ambulance pulled up to the emergency room entrance at University Hospital. The back doors flew open and a team of doctors and nurses waited outside. They pulled Keisha's stretcher out and rushed her inside. James ran after them. A doctor in blue scrubs intercepted him. Sir, I'm Dr. Rachel Kim. I'm going to be treating your wife. I need you to wait here while we assess her. A nurse will come get you as soon as we have information. What's wrong with her? James demanded. That other doctor sent her home and said she was fine. He said she was faking. Dr. Kim's expression hardened. When did she see another doctor? This evening. At St. Catherine's around 6 o'clock. He barely looked at her. He accused her of drug seeking and sent us home. Dr. Kim pulled out her phone and made a note. What was the doctor's name? Dr. Marcus Webb. Thank you. We're going to take excellent care of your wife. I promise you. Dr. Kim squeezed James's shoulder and then disappeared through the emergency room doors. James stood alone in the waiting area, his heart pounding. He pulled out his phone with shaking hands and called Keisha's mother. Mom, something's happened. You need to come to University Hospital right away. Inside the emergency room, Dr. Rachel Kim worked quickly. She was a Korean-American woman in her late 30s who had seen too many cases like this. She looked at Keisha's gray skin, felt her cold hands, saw the distended abdomen. This woman was in serious trouble. I need a full blood panel, coagulation studies, and blood type and cross-match for possible transfusion, Dr. Kim ordered. Get me an ultrasound machine in here now. And page surgery. Tell them we likely have a surgical emergency. Nurses moved quickly around her. One inserted additional IV lines. Another drew blood for the tests. A third wheeled in the ultrasound machine. Dr. Kim placed the ultrasound probe on Keisha's abdomen. She moved it slowly, studying the images on the screen. What she saw made her curse under her breath. There's free fluid in the abdomen, she said. Significant amount. This is internal bleeding. Page surgery again. Tell them we need the OR ready immediately. Blood pressure is continuing to drop, a nurse called out. Give me 2 units of O-negative blood now, Dr. Kim said. We're not waiting for the type and cross. This patient is bleeding out. The blood test results came back quickly. Keisha's white blood cell count was extremely high. Her blood pressure was dangerously low. She was showing early signs of sepsis. Her body was shutting down. A tall man in surgical scrubs rushed into the room. I'm Dr. Peterson. What do we have? Dr. Kim quickly explained the situation. 34-year-old female with history of endometriosis. Presented at another facility earlier today with severe abdominal pain and was sent home. Now presenting with signs of intra-abdominal hemorrhage and early sepsis. Ultrasound shows significant free fluid. She needs surgery now. Dr. Peterson looked at the ultrasound images and nodded. Agreed. Let's get her upstairs. They wheeled Keisha toward the elevators that would take her to the operating room. Dr. Kim stopped to talk to James, who stood up the moment he saw her. Your wife has internal bleeding, Dr. Kim explained gently. We believe she has a ruptured ovarian cyst that's been bleeding into her abdomen. She's also showing signs of infection. We need to take her to surgery immediately. James felt his legs go weak. Surgery? Is she going to survive? We're going to do everything we can. Dr. Peterson is an excellent surgeon. But I need you to understand that your wife is very sick. If she had gotten proper treatment when she first came to the emergency room this evening, this wouldn't have happened. That doctor, James said, his voice breaking. That doctor at St. Catherine's, he did this to her. Right now, my focus is on saving your wife's life, Dr. Kim said. But I want you to know that everything that happens here tonight will be thoroughly documented. Now I need you to sign consent forms for the surgery. A nurse brought the paperwork. James signed without reading, his hands shaking so badly he could barely hold the pen. How long will the surgery take? He asked. Several hours, probably. There's a surgical waiting room on the 4th floor. We'll update you as soon as we can. James watched them wheel his wife toward the operating room. She looked so small on that stretcher, so fragile. He thought about the doctor who had sent her home, who had looked at her with suspicion instead of concern, who had spent 3 minutes examining her before deciding she was lying. Keisha's mother arrived 30 minutes later. Her name was Patricia, and she was a strong woman who rarely showed emotion. But when James explained what happened, she broke down crying. My baby, she sobbed. My baby girl. James held his mother-in-law while they both cried. Then they sat together in the surgical waiting room, watching the clock, praying. In the operating room, Dr. Peterson and his team worked carefully. When they opened Keisha's abdomen, they found what Dr. Kim had suspected. A large ovarian cyst on her right ovary had ruptured. Blood filled her abdominal cavity. The ovary itself was damaged beyond repair. Worse, the blood and cyst fluid had been sitting in her abdomen for hours, causing infection. We need to remove the ovary, Dr. Peterson said. There's no saving it. The surgery took 3.5 hours. They removed Keisha's right ovary, cleaned out the infected blood and fluid, and repaired the damage. They pumped antibiotics and more blood into her veins, fighting the infection that had begun spreading through her body. Finally, Dr. Peterson stepped back from the operating table. That's all we can do. The rest is up to her. They wheeled Keisha to the intensive care unit. Dr. Peterson went to the surgical waiting room to talk to James and Patricia. It was nearly 3 a.m. Your wife made it through surgery, he said, but she's not out of danger yet. She lost a significant amount of blood. She had a ruptured ovarian cyst that caused internal bleeding and infection. We had to remove her right ovary. The next 24 to 48 hours will be critical. Can we see her? Patricia asked. Keisha spent 3 days in the intensive care unit. For the first 2 days, she remained on a ventilator, her body fighting the infection that had spread through her system. James never left her side except when the nurses forced him to go eat or rest. Patricia brought him clothes and food, staying in the ICU waiting room so she could be nearby. On the 3rd day, Keisha opened her eyes. She looked confused and scared. James pressed the call button immediately, and nurses rushed into the room. Dr. Kim came shortly after. Welcome back, Dr. Kim said gently. You're at University Hospital. You had emergency surgery. Do you remember anything? Keisha's throat hurt from the breathing tube that had just been removed. She shook her head slightly. You had a ruptured ovarian cyst, Dr. Kim explained. It caused internal bleeding and infection. We had to remove your right ovary. You're going to be okay, but you need time to recover. Tears rolled down Keisha's cheeks. James wiped them away gently with a tissue. The other hospital, Keisha whispered, her voice rough. That doctor. He sent me home. Dr. Kim's expression grew serious. I know, and that's going to be addressed. But right now you need to focus on getting better. Over the next week, Keisha slowly improved. She was moved from the ICU to a regular hospital room. The pain from surgery was intense, but at least the doctors here believed her when she said she was hurting. They gave her proper pain medication and checked on her regularly. Dr. Kim visited every day, checking Keisha's progress and talking to her about what happened. On the 5th day after surgery, she sat down beside Keisha's bed with a serious expression. I want to talk to you about something important, Dr. Kim said. What happened to you at St. Catherine's Medical Center was medical negligence. It was also, I believe, discrimination. You nearly died because a doctor refused to properly examine you and listen to your concerns. Keisha looked down at her hands. He didn't believe me. He looked at me and decided I was lying about my pain. I've documented everything, Dr. Kim said. Your medical records from St. Catherine's show that Dr. Webb spent less than 3 minutes examining you. He ordered no blood work, no imaging, nothing that would have revealed what was actually happening in your body. He wrote in his notes that he suspected drug-seeking behavior. There was no medical basis for that assessment. What should I do? Keisha asked. That's your decision, Dr. Kim said. But if this happened to you, it's probably happened to other patients. Someone needs to hold that doctor accountable. After Dr. Kim left, Keisha talked to James about it. I'm scared, she admitted. What if people think I'm just trying to get money? What if they say I'm playing the race card? James took her hand. Baby, you almost died. You lost an organ. You're going to need months to recover. That doctor was negligent, and we both know why. He looked at you and made assumptions based on the color of your skin. Patricia, who had been sitting quietly in the corner, spoke up. Your grandmother marched in the civil rights movement. She faced police dogs and fire hoses so that people like you could have equal treatment. Don't let that doctor's prejudice go unanswered. Keisha thought about her grandmother, about all the women who had fought for justice before her. She thought about other black women who might sit in Dr. Webb's examination room experiencing pain, only to be dismissed and sent home. She made her decision. I want to talk to a lawyer, she said. James smiled and pulled out his phone. I already did some research. There's an attorney named David Park. He specializes in medical malpractice and civil rights cases. He's supposed to be one of the best. 2 days later, David Park came to visit Keisha in the hospital. He was a Korean-American man in his mid-40s with kind eyes and a serious demeanor. He carried a leather briefcase and a digital recorder. Thank you for seeing me, he said, pulling up a chair beside her bed. I want to hear your story if you're comfortable sharing it. Keisha told him everything. She described the pain, the visit to St. Catherine's, Dr. Webb's dismissive attitude, being sent home, collapsing, the emergency surgery. David listened carefully, taking notes and occasionally asking questions. When she finished, David sat back in his chair. I'm going to be honest with you. This is a strong case, but it's also going to be difficult. We'll have to prove not just negligence, but also discrimination. That means examining Dr. Webb's treatment of other patients, looking for patterns. Are you prepared for that? This could take months, maybe years. I'm prepared, Keisha said firmly. If he did this to me, he's probably done it to others. Someone has to stop him. David smiled. Good, then let's get started. I'll need copies of all your medical records from both hospitals. I'll also need to interview anyone who was present during your examination at St. Catherine's. Over the next 2 weeks, David began his investigation. He requested Keisha's medical records from St. Catherine's Medical Center. When they arrived, he read through them carefully. The documentation was damning. Dr. Webb had written that Keisha arrived at the emergency room complaining of abdominal pain. He noted her history of endometriosis but dismissed it as relevant. His physical examination notes were brief. Abdomen soft, mild tenderness. No guarding. He had spent 3 minutes with her total. Most troubling was his final assessment. Patient appears to be drug-seeking. No acute pathology identified. Prescription given for basic analgesic. Patient advised to follow up with primary care physician. David compared these notes to the records from University Hospital. The contrast was shocking. Dr. Kim's notes were detailed and thorough. She had documented low blood pressure, elevated heart rate, distended abdomen, significant internal bleeding, ruptured ovarian cyst, emergency surgery, removal of ovary, and sepsis. All of this had been developing when Dr. Webb saw Keisha. A proper examination would have revealed it. But David knew medical records alone wouldn't be enough. He needed to establish a pattern. He filed a request with the State Medical Board for any complaints filed against Dr. Marcus Webb. Then he began the harder work of finding Dr. Webb's former patients. He started by posting carefully worded messages on medical advocacy forums and social media, groups for people with chronic pain conditions. If you received treatment at St. Catherine's Medical Center ER and felt your concerns were dismissed, please contact our office. The responses started coming in within days. David was shocked by how many people reached out. Most were women. Most were people of color. All of them had stories about Dr. Marcus Webb. David scheduled interviews with the most promising cases. One woman named Amber Williams agreed to meet him at his office. She was a black woman in her late 20s who worked as a teacher. Dr. Webb saw me last year, Amber told David. I came into the emergency room because I couldn't breathe properly. I felt like there was pressure on my chest. I was scared I was having a heart attack. What did Dr. Webb do? David asked. He listened to my heart for maybe 10 seconds. Then he told me I was having anxiety and that I should try meditation and yoga. He actually told me yoga. Amber's voice was bitter. I went home, but the breathing got worse. 2 days later, I went to a different hospital. They found a pulmonary embolism, a blood clot in my lung. The doctor there said if I had waited any longer, I could have died. David wrote down every detail. Did you file a complaint? I did. With the hospital and with the medical board? Nothing happened. They said Dr. Webb's examination was within the standard of care. David interviewed 3 more former patients over the next week. Their stories were similar. A Hispanic woman named Maria Gonzalez had been sent home with what Dr. Webb called menstrual cramps. She later learned she had appendicitis and needed emergency surgery at another hospital. A black man named Marcus Johnson had been accused of faking a broken arm because Dr. Webb didn't think his injury story made sense. Another hospital confirmed the break and put his arm in a cast. The pattern was undeniable. Dr. Webb consistently dismissed the pain and concerns of patients of color. He spent less time with them, ordered fewer tests, and frequently accused them of exaggerating or lying. David also learned something interesting from his research. A nurse named Sarah Chen had recently left St. Catherine's Medical Center. According to other staff members David spoke with, Sarah had been present during Keisha's examination and had seemed upset afterward. David tracked down Sarah's contact information and called her. She agreed to meet him at a coffee shop near her new workplace. Sarah was a young Asian American woman who looked nervous as she sat down across from David. I want to help, she said immediately. But I'm scared. I need to work in this town, and if I become known as someone who testifies against doctors, I understand your concerns, David said gently. But I need to know what you saw. Sarah took a deep breath. Dr. Webb barely looked at Ms. Morrison. He walked in, interrupted her when she tried to explain her medical history, and did the most superficial examination I've ever seen. He pressed on her abdomen for maybe 10 seconds. He didn't order any tests, and then he made that note about drug seeking. Did Ms. Morrison say or do anything that would justify that note? David asked. No, nothing. She was professional and polite. She was clearly in real pain. She even specifically mentioned her endometriosis history and asked if he should do an ultrasound. He shot her down. Sarah's hands trembled as she held her coffee cup. I wanted to say something, but Dr. Webb is the head of the emergency department. He's been there for 15 years. Everyone knows he has attitudes about certain patients, but no one says anything because he's protected by the administration. Attitudes about certain patients, David repeated. You mean patients of color? Sarah nodded. I've seen him spend 45 minutes with a white patient with similar complaints. But with black and Hispanic patients, he rushes through. He's dismissive. He makes assumptions. Would you be willing to testify to this in a deposition? David asked. Sarah was quiet for a long moment. Then she nodded. Yes, what happened to Ms. Morrison was wrong. If I stay silent, I'm part of the problem. David reached across the table and shook her hand. Thank you. You're doing the right thing. Back at his office, David organized all the information he had gathered. He had Keisha's medical records showing Dr. Webb's negligent care. He had records from University Hospital showing the emergency that Dr. Webb had missed. He had testimony from former patients establishing a pattern of discriminatory treatment. He had a nurse willing to testify about what she witnessed. He also requested data from St. Catherine's Medical Center showing Dr. Webb's treatment patterns over the past 5 years. How long did he spend with patients of different races? What were his testing and admission rates broken down by race? The hospital initially refused to provide this data, but David filed a motion with the court, and they were eventually forced to comply. When the data came back, it confirmed what David suspected. Dr. Webb's black patients waited an average of 40% longer to be seen. They received pain medication at lower rates. They had shorter examination times. They were sent home, without testing at significantly higher rates than white patients with identical symptoms. David sat at his desk late one evening, reviewing all the evidence. He thought about Keisha Morrison still recovering from surgery, dealing with the physical and emotional trauma of what happened to her. He thought about all the other patients who had been harmed by Dr. Webb's prejudice. He opened his laptop and began drafting the complaint. He would file charges of medical negligence and racial discrimination against both Dr. Marcus Webb and St. Catherine's Medical Center. The hospital had enabled Dr. Webb's behavior for years, ignoring complaints and allowing him to continue practicing despite clear evidence of bias. This was going to be a fight. The hospital would have expensive lawyers. Dr. Webb would deny everything. But David had the evidence, and he had witnesses willing to tell the truth. He thought about what Keisha had said to him during their first meeting. If he did this to me, he's probably done it to others. She was right. And now, finally, Dr. Marcus Webb was going to be held accountable. Dr. Marcus Webb sat in his office at St. Catherine's Medical Center, reviewing patient charts. It was a Tuesday afternoon, and the emergency department was having a slow day. He sipped his coffee and thought about his retirement plans. 5 more years and he would be done with medicine. 5 more years, and he could finally relax. His desk phone rang. He picked it up without looking at the caller ID. Dr. Webb. Marcus, this is Margaret Stevens. Her voice was tense. Margaret was the hospital's chief legal counsel. Margaret, what can I do for you? I need you to come to the legal department right now. We have a situation. Something in her tone made Dr. Webb's stomach tighten. What kind of situation? Just come now, please. Dr. Webb hung up and walked down the corridor to the legal department. His mind raced through possibilities. Had he made a medication error? Had a patient died unexpectedly? He couldn't think of anything recent that would require legal attention. Margaret's office was on the 3rd floor. Her secretary waved him in immediately. Margaret sat behind her desk, and beside her sat the hospital's chief executive officer, Robert Harrison. Both of them looked grim. Marcus, sit down, Margaret said. Dr. Webb sat in the chair across from them, feeling like a student called to the principal's office. What's this about? Margaret slid a thick document across the desk. A lawyer named David Park filed this lawsuit yesterday. It names you and the hospital as defendants. Dr. Webb picked up the document. The title page read, Keisha Morrison, Plaintiff versus Dr. Marcus Webb and St. Catherine's Medical Center, Defendants. Civil action for medical negligence and racial discrimination. The words racial discrimination felt like a punch to the gut. What? This is ridiculous. Who is Keisha Morrison? Do you remember treating a black woman in the emergency room about 6 weeks ago? Margaret asked. She came in with abdominal pain. Dr. Webb closed his eyes, trying to remember. He saw dozens of patients every week. Vaguely. Maybe. What about her? You examined her for approximately 3 minutes, according to your own notes. You sent her home with basic pain medication. You wrote in your assessment that you suspected drug-seeking behavior. Margaret's voice was flat, professional. 6 hours later, she collapsed at home. She was rushed to University Hospital where they discovered a ruptured ovarian cyst causing internal bleeding and sepsis. She required emergency surgery. They had to remove her ovary. Dr. Webb felt his mouth go dry. I examined her. There was nothing acute. She was. She was what, Marcus? Robert Harrison's voice was hard. The complaint includes her medical records from both hospitals. It includes testimony from a nurse who was present during your examination. It includes statistical analysis of your treatment pattern showing racial disparities. And it includes testimony from at least 4 other patients of color who claim you provided inadequate care. This is insane, Dr. Webb said, his voice rising. I've been practicing medicine for 25 years. I've never discriminated against anyone. I treat all my patients the same. The data says otherwise, Margaret replied. She pulled out another document. The plaintiff's attorney subpoenaed 5 years of your patient records. The analysis shows that your black patients wait longer, receive less pain medication, have shorter examination times, and are discharged without testing at significantly higher rates than your white patients with identical symptoms. That could be explained by other factors. Maybe those patients came in during busier times. Maybe their symptoms were different. Dr. Webb was grasping for explanations, feeling panic rise in his chest. Your notes on Ms. Morrison specifically mention suspected drug seeking, Margaret said. There was nothing in your examination to support that assessment. She had a known history of endometriosis. She specifically mentioned previous ovarian cysts. She was asking for appropriate testing. Instead, you spent 3 minutes with her and sent her home. I made a medical judgment, Dr. Webb insisted. Sometimes patients with chronic pain conditions do seek drugs. I was being cautious. You were being prejudiced, Robert Harrison said bluntly. And now you've put this entire hospital at risk. We're facing a multi-million-dollar lawsuit and the plaintiff has a very strong case. Dr. Webb felt his world tilting. What happens now? Margaret leaned forward. The hospital's insurance company is sending their lawyers. They'll represent both you and the hospital. But Marcus, I need you to understand something. This is very serious. This woman almost died. And the evidence that you provided inadequate care based on racial bias is substantial. I'm not a racist, Dr. Webb said, his voice shaking. I'm not. That's what you'll have to prove, Margaret said. In the meantime, effective immediately, you're suspended from clinical duties pending an internal investigation. You'll continue to receive your salary, but you cannot treat patients. Suspended? Doctor. Webb stood up. You can't do this. I have patients who depend on me. Sit down, Marcus, Robert Harrison commanded. We absolutely can do this, and we are doing this. If this goes to trial and we haven't taken action, it makes the hospital look negligent. You will stay home. You will cooperate fully with our lawyers and you will not speak to anyone about this case. Do you understand? Dr. Webb sank back into his chair. For how long? Until this is resolved, Margaret said. That could be months, maybe longer. Dr. Webb left the legal department in a daze. He walked back to his office and began packing his personal items. Other doctors and nurses watched him curiously, whispering. Word was already spreading through the hospital. A younger doctor named Jennifer Park approached him. Dr. Webb, is everything okay? I've been suspended, he said, not looking at her. There's a lawsuit. Someone claiming I provided inadequate care. Jennifer's expression shifted to something Dr. Webb couldn't quite read. Is it about Keisha Morrison? Webb's head snapped up. You know about it? Everyone's heard. The nurses have been talking about it for weeks. Sarah Chen told people what happened before she left. Sarah Chen, Dr. Webb repeated. He remembered her now. The young nurse who had been in the room. She has no right to discuss patient care. She has every right to report negligence, Jennifer said quietly. Dr. Webb, I've worked here for 3 years. I've seen how you treat certain patients. A lot of us have. Dr. Webb stared at her. What are you talking about? You spend less time with Black and Hispanic patients. You're more dismissive. You make assumptions. Jennifer's voice was calm but firm. Some of us have discussed reporting it. But you're the department head. No one wanted to risk their career. Get out of my office, Dr. Webb said. Jennifer nodded and left. Dr. Webb sat down heavily in his chair, his box of personal items forgotten on the desk. He thought about his career, his reputation, everything he had built over 25 years. It was all crumbling because of one patient, one complaint, one lawsuit. He drove home in silence, his mind numb. His wife Linda was surprised to see him home early. Marcus? What's wrong? He told her everything. About the lawsuit, the suspension, the accusations. Linda listened quietly, her expression growing more concerned. Marcus, did you really spend only 3 minutes with this woman? Linda asked. I don't know. I don't remember. It was a busy day. Dr. Webb rubbed his face with both hands. I see hundreds of patients. I can't spend 45 minutes with everyone. Linda picked up the complaint document he had brought home. She read through it carefully. When she finished, she looked at her husband with troubled eyes. Marcus, this says you wrote that she was drug-seeking. Why would you write that? Because chronic pain patients often are, he said defensively. But she had a ruptured cyst. She was bleeding internally. How did you miss that? I didn't miss anything, Dr. Webb said, his voice rising. I did a physical exam. There was no evidence of acute pathology. Linda set down the document. Marcus, I've been married to you for 30 years. I know you. And I think you need to be honest with yourself about something. About what? About your biases. About how you see certain patients. Linda's voice was gentle but serious. I've heard you talk about patients before. The things you say about people who come to the ER. The assumptions you make. What assumptions? Dr. Webb felt anger building. I'm being railroaded here, and even my own wife thinks I'm guilty. I think you're a good doctor who has some blind spots, Linda said carefully. And I think this woman almost died because of those blind spots. Dr. Webb stood up. I'm going for a walk. He left the house and walked through his neighborhood, his mind churning. He thought about Keisha Morrison. He tried to remember her face, her voice, the examination. It was all a blur. She was just one patient among hundreds, but she had almost died. She had lost an organ, and it had happened because he sent her home. Dr. Webb walked for over an hour. When he returned home, he found Linda in the kitchen making dinner. She looked at him with concern. Are you okay? No, he admitted. I'm not okay. Over the next few weeks, Dr. Webb met repeatedly with the hospital's lawyers. They prepared him for depositions, reviewed his medical records, and discussed strategy. The lawyers were professional but not warm. He got the feeling they didn't believe him completely. The key is to maintain that you provided appropriate care based on the information available at the time, the lead attorney, a man named Charles Wright, explained. You cannot admit to racial bias. You cannot admit that you spent too little time with the patient. You stick to the fact that you used your medical judgment. But I did use my medical judgment, Dr. Webb insisted. Charles gave him a long look. Dr. Webb, I've reviewed your records. I've seen the data analysis. Your treatment of patients of color is statistically different from your treatment of white patients. In a courtroom, that's going to be very difficult to explain away. So what should I do? We'll try to settle, Charles said. The plaintiff wants money, hospital policy changes, and your license reviewed. If we can give them money and policy changes, maybe they'll drop the demand about your license. I don't want to settle, Dr. Webb said. That makes me look guilty. You're going to lose if this goes to trial, Charles said bluntly. The evidence is overwhelming. Your best option is to settle, accept whatever discipline the medical board imposes, and try to salvage what's left of your career. Dr. Webb left the meeting feeling defeated. He went home and sat in his darkened study, staring at his medical degree on the wall. 25 years of practice. Thousands of patients treated. And now, because of one case, everything was falling apart. His phone rang. It was Margaret Stevens. Marcus, I wanted to give you a heads up. The local news is running a story about the lawsuit tomorrow night. The plaintiff has agreed to do an interview. Dr. Webb's heart sank. They're putting this on television? It's a compelling story. Black woman nearly dies after doctor dismisses her concerns. The reporter is framing it as a piece about racial bias in healthcare. Margaret's voice was sympathetic. I'm sorry, Marcus. This is going to get worse before it gets better. Can I do an interview too? Tell my side? Absolutely not. The lawyers would kill me if I let you do that. You are not to speak to the media under any circumstances. After she hung up, Dr. Webb sat in the darkness and realized something. For the first time in his life, he had no control. The lawsuit was moving forward. His name would be on television. People he had known for years were whispering about him. And there was nothing he could do to stop it. He thought about Keisha Morrison recovering from surgery, missing an organ, dealing with trauma that would last for years. And for the first time, he allowed himself to wonder, had he really provided appropriate care? Or had he looked at a black woman in pain and made assumptions he would never have made with a white patient? The question terrified him because deep down he knew the answer. The deposition took place on a cold morning in March, 4 months after Keisha's surgery. She sat in a conference room at David Park's law office, surrounded by lawyers. David sat beside her, offering quiet support. Across the table sat Dr. Marcus Webb, his attorney Charles Wright, and lawyers representing St. Catherine's Medical Center. A court reporter sat in the corner, her fingers moving quickly across the stenography machine. Everything said in this room would become part of the official record. Charles Wright began the questioning. Ms. Morrison, can you describe your medical history with endometriosis? Keisha spoke calmly, explaining her diagnosis 10 years earlier. Her previous treatments, her history of ovarian cysts. She had prepared for this moment, rehearsing with David. She kept her answers clear and factual. And on the day in question, "What made you decide to go to the emergency room?" Charles asked. "The pain was different," Keisha explained. "I've had endometriosis pain for a decade. I know what it feels like. This was sharper, more intense, and getting worse quickly. I knew something was seriously wrong." "But you've had pain before, correct? How could you be sure this was different?" "Because I know my body," Keisha said firmly. "Just like you would know if your pain was different from normal. I wasn't overreacting. I was experiencing a medical emergency." Charles moved on to questions about her interaction with Dr. Webb. Keisha described the examination in detail, or rather the lack of examination. She explained how Dr. Webb had cut her off when she tried to explain her medical history, how he barely touched her abdomen, how he refused to order any tests. "Did you specifically ask Dr. Webb to do something?" Charles asked. "Yes. I asked if he was going to do an ultrasound. I mentioned that when I had a cyst before they had done imaging. He said it wasn't necessary." "And what happened when Dr. Webb suggested you were seeking drugs?" Keisha's voice remained steady, though the memory still hurt. "He said I appeared to be drug-seeking. My husband protested. I tried to explain that I was in genuine pain and needed help. Dr. Webb said if I continued to insist on unnecessary tests and medication, he would have to note drug-seeking behavior in my chart. How did that make you feel?" Charles asked. David objected. "Relevance? I'm establishing the plaintiff's state of mind," Charles said. "You can answer," David told Keisha. "It made me feel humiliated and scared," Keisha said. "I felt like I wasn't being seen as a person. I felt like he had already decided I was lying before he even examined me." The deposition continued for 3 hours. Charles tried to poke holes in Keisha's story, suggesting that perhaps she hadn't been clear about her symptoms, that perhaps Dr. Webb had good reasons for his decisions. But Keisha's testimony was consistent and powerful. When it was David's turn to question Dr. Webb, the atmosphere in the room changed. Dr. Webb looked tired and defensive. He avoided making eye contact with Keisha. "Dr. Webb, according to your own notes, you spent approximately 3 minutes examining Ms. Morrison. Is that correct?" David began. "I don't recall the exact time," Dr. Webb said. "Your notes indicate you entered the room at 6:15 p.m. and left at 6:18 p.m. That's 3 minutes. If that's what the notes say, is 3 minutes adequate time to properly assess a patient complaining of severe abdominal pain? It depends on the situation. Sometimes a quick assessment is sufficient." David pulled out a document. "I have your notes from another patient, a white woman named Jennifer Thompson, seen 1 week earlier. She also complained of abdominal pain. You spent 42 minutes with her. You ordered blood work, a CT scan, and an ultrasound. Why the difference?" Charles objected. "That's a different patient with different circumstances." "I'm establishing a pattern," David said calmly. "Dr. Webb, why did Ms. Thompson receive comprehensive testing while Ms. Morrison received none? Each patient is different. I make decisions based on the specific presentation. Ms. Morrison had a known history of ovarian cysts. Ms. Thompson had no previous abdominal issues. Yet you spent 14 times longer with Ms. Thompson and ordered extensive testing. Can you explain that?" Dr. Webb shifted in his seat. "Without reviewing both cases in detail, I can't comment on specific differences." David introduced more examples. A Hispanic man with chest pain who had been sent home after 5 minutes and later diagnosed with a heart condition at another hospital. A black woman with severe headaches who had been told she was stressed and later found to have a brain aneurysm. In each case, Dr. Webb had spent minimal time, ordered minimal testing, and sent the patient home. In each case, the patient was later found to have a serious condition. "Dr. Webb, are you familiar with the concept of implicit bias?" David asked. "I am. Do you believe you have any implicit biases regarding race?" "No, I treat all patients the same." David pulled out the statistical analysis. "This document analyzes 5 years of your patient care. It shows that your black patients wait an average of 38 minutes longer to be seen than white patients. They receive pain medication at a rate 42% lower than white patients with identical complaints. You spend an average of 12 minutes less time with patients of color. How do you explain these numbers?" Those numbers could be influenced by many factors. Time of day, how busy the emergency room was, the specific nature of their complaints. The analysis controls for all those factors, David said. The disparity remains. Dr. Webb, the evidence suggests you provide different levels of care based on the race of your patients. Is that correct? No, that's not correct. I'm a good doctor. I've dedicated my life to helping people. But you didn't help Ms. Morrison, did you? You sent her home to die. Charles objected loudly. Inflammatory. Withdrawn, David said. Dr. Webb, if you had ordered even basic blood work on Ms. Morrison, what would it have shown? Dr. Webb was quiet for a moment. Elevated white blood cell count. Possible signs of infection. And if you had ordered an ultrasound, it would have shown the cyst and possibly the internal bleeding. And if you had admitted her for observation, she would have received treatment before the situation became critical. So your decision to send her home, based on a 3-minute examination with no testing, nearly cost Ms. Morrison her life. Is that a fair assessment? Dr. Webb looked down at his hands. In hindsight, I should have done more. But at the time, based on my examination, I didn't believe she was in acute distress. Even though she told you she was in severe pain, even though she had a history of ovarian cysts, even though she specifically asked for imaging, I used my medical judgment. Your medical judgment was wrong, and Ms. Morrison lost an organ because of it. The deposition ended shortly after. As everyone gathered their papers, Keisha finally looked directly at Dr. Webb. He met her gaze for just a moment before looking away. Outside the building, Keisha sat in David's car and cried. I thought I'd feel better after confronting him, she said. But I just feel sad. He's realizing what he did, David said gently. That's something. Not enough, but something. The case moved forward. More depositions were taken. Sarah Chen testified about what she witnessed, describing Dr. Webb's dismissive attitude and the inadequate examination. Dr. Rachel Kim from University Hospital testified about the seriousness of Keisha's condition when she arrived and how proper care at St. Catherine's would have prevented the emergency. Medical experts reviewed the case. All of them agreed that Dr. Webb's care fell below the standard of practice. One expert, Dr. Elizabeth Moore, a respected emergency medicine physician, was particularly damning in her testimony. Dr. Webb's examination was inadequate by any measure, Dr. Moore testified. A patient presenting with severe abdominal pain and a history of ovarian cysts should receive at minimum a physical exam, blood work, and imaging. To send her home after 3 minutes with no testing is indefensible. In your opinion, did Dr. Webb's actions constitute negligence? David asked. Yes, clear negligence. And in your review of his patient care patterns, did you see evidence of racial bias? Objectively, yes. The statistical disparities are too significant to be coincidental. Dr. Webb consistently provides less thorough care to patients of color. That's not just bad medicine, it's discrimination. The hospital tried to mount a defense, but the evidence was overwhelming. Internal emails showed that multiple complaints had been filed about Dr. Webb's treatment of minority patients over the years, but the hospital administration had taken no action. They had protected Dr. Webb because he was a senior physician who brought in revenue for the emergency department. 6 months after the lawsuit was filed, St. Catherine's Medical Center approached David about settlement. The insurance company had seen the evidence and knew they would lose at trial. They're offering $2 million, David told Keisha during a meeting at his office. They're also agreeing to implement new policies, mandatory bias training for all staff, independent patient advocates in the emergency department, and a system for anonymous reporting of discriminatory treatment. What about Dr. Webb? Keisha asked. What happens to him? They're terminating his employment, and we're filing a complaint with the state medical board. They'll hold a hearing to determine if his license should be revoked. Keisha thought about it. The money would help with her medical bills and lost wages. The policy changes might help other patients, but she wanted more than that. I want to testify at the medical board hearing, she said. I want to look them in the eye and tell them what happened. I want to make sure he never does this to anyone else. You don't have to do that, David said gently. You've been through enough. I need to do it, Keisha said firmly. For me, and for every other patient he dismissed. After several weeks of negotiation, both sides agreed to the settlement terms. $2.3 million for Keisha, policy changes at the hospital, termination of Dr. Webb's employment, and a recommendation to the state medical board that his license be suspended. On the day they signed the settlement agreement, Keisha felt a mix of emotions. Relief that the legal battle was over, satisfaction that the hospital was being held accountable, but also sadness that it had come to this at all. "Thank you," she said to David after signing the papers, "for believing me, for fighting for me." "You did the hard part," David replied. "You told your story. You stood up for yourself. That takes real courage." That evening, Keisha sat with James in their living room. She touched her abdomen, where surgical scars still reminded her of what she had lost. "It's over," she said quietly. "The lawsuit is over," James corrected, "but the real work is just beginning." He was right. The medical board hearing was scheduled for 3 months later, and Keisha had already started thinking about what she wanted to do next, how she could use her experience to help others, to create real change in a system that had failed her so badly. But tonight she allowed herself to simply feel relief. She had fought and she had won. It wasn't complete justice. Nothing could give her back what she had lost. But it was something. It was accountability. It was a small step toward a world where Black women's pain would be taken seriously, where doctors like Marcus Webb would face consequences for their prejudice. It was a beginning. The state medical board hearing took place on a warm morning in June, almost 9 months after the night that changed Keisha's life. The hearing room was formal and intimidating, with dark wood paneling and a long table where 5 board members sat. Dr. Webb sat with his attorney on one side of the room. Keisha sat with David on the other. The board had already reviewed all the evidence from the lawsuit, the medical records, the depositions, the statistical analysis. Today was the formal hearing where they would hear testimony and make their decision about Dr. Webb's medical license. Dr. Patricia Williams, the board chairwoman, called the hearing to order. She was a Black woman in her 60s with kind eyes and a serious demeanor. "We're here today to determine whether Dr. Marcus Webb violated the standards of medical practice and whether his license to practice medicine should be revoked, suspended, or restricted," Dr. Williams said. "Dr. Webb, you have the right to present evidence and testimony in your defense." Charles Wright stood. "Thank you, Dr. Williams. We believe the evidence will show that Dr. Webb made a reasonable medical judgment based on the information available at the time. While the outcome was unfortunate, it does not rise to the level of license revocation." "The board will determine that," Dr. Williams said. She turned to Keisha. "Ms. Morrison, I understand you wish to make a statement?" Keisha stood up, her hands trembling slightly. She had practiced this statement for weeks, but now that the moment was here, her heart pounded. She looked at Dr. Webb, who sat with his eyes downcast. "My name is Keisha Morrison," she began. 9 months ago, I went to St. Catherine's Medical Center emergency room because I was in severe pain. I knew something was seriously wrong with my body. I have endometriosis and I've lived with pain for years, so I know the difference between my normal pain and a medical emergency. This was an emergency." She paused, gathering her thoughts. "Dr. Webb spent 3 minutes with me. He barely listened when I tried to explain my medical history. He didn't order any tests. He touched my abdomen for maybe 10 seconds, and then he accused me of seeking drugs. When I tried to tell him I needed help, he threatened to write in my chart that I was drug-seeking if I didn't stop asking for proper care." Her voice grew stronger. 6 hours after Dr. Webb sent me home, I collapsed. My husband found me unconscious in our bathroom. An ambulance rushed me to a different hospital, where real doctors took me seriously. They discovered I had a ruptured ovarian cyst causing internal bleeding and sepsis. I was dying. They operated for 3.5 hours to save my life. I lost my right ovary. I spent days in intensive care. I will never be able to have the 3 children my husband and I planned. Keisha's eyes filled with tears, but she continued. This wasn't just bad medical care. This was discrimination. Dr. Webb looked at me, a Black woman, and made assumptions. He decided before he even examined me that I wasn't worth his time, that I was lying, that I was looking for drugs, and I nearly died because of his prejudice. She looked directly at the board members. I'm not the only one. Other patients came forward with similar stories. Black women and men, Hispanic patients, Asian patients, all of them dismissed by Dr. Webb, all of them given inadequate care. Some of them nearly died just like me. This isn't about one mistake. This is about a pattern of discrimination that lasted years. Keisha took a deep breath. I'm here today to ask you to revoke Dr. Webb's license permanently. He should never practice medicine again, because as long as he's a doctor, Other patients like me are in danger. Other black women will walk into an emergency room in pain and be sent home to die. Someone has to stop him. You have to stop him. She sat down, her legs shaking. James reached over and squeezed her hand. Dr. Williams nodded solemnly. Thank you, Ms. Morrison. That was very powerful testimony. She turned to Dr. Webb. Dr. Webb, would you like to make a statement? Dr. Webb stood slowly. He looked older than he had at the deposition, thinner and tired. He cleared his throat. I've been practicing medicine for 25 years, he said, his voice quiet. I became a doctor because I wanted to help people. I took an oath to do no harm. And I failed. I failed Ms. Morrison, and I failed other patients. He paused, struggling with his words. For months I told myself that I made a reasonable medical judgment, that I couldn't have known, that I was being unfairly attacked. But the truth is I did know. Deep down I knew. When Ms. Morrison told me she was in severe pain, I should have listened. When she mentioned her history of cysts, I should have ordered tests. But I didn't, and I didn't because... He stopped, his voice breaking. I didn't because I looked at her and made assumptions. Assumptions based on her race. Assumptions I wouldn't have made with a white patient. I told myself I wasn't prejudiced, that I treated everyone the same. But I was lying to myself. The data doesn't lie. My black patients received worse care, and Ms. Morrison nearly paid for my bias with her life. The room was silent. Dr. Webb looked at Keisha for the first time. I am so deeply sorry for what I did to you. Sorry isn't enough, and nothing I say can undo the harm I caused. But I want you to know that I understand now. I understand what I did and why it was wrong. And I accept whatever consequences the board decides. He sat down heavily. His attorney looked surprised. This clearly wasn't the statement they had prepared. The board asked questions. They reviewed the medical records in detail. They discussed the statistical evidence showing Dr. Webb's pattern of discriminatory care. They heard testimony from Dr. Rachel Kim, who explained how close Keisha had come to dying. After 3 hours of testimony and discussion, Dr. Williams called for a recess so the board could deliberate. Keisha and James waited in the hallway outside. David brought them coffee and tried to keep their spirits up. Whatever happens, you did something important today, David said. You told your truth. An hour later, they were called back into the hearing room. The board members looked grave as everyone took their seats. Dr. Williams spoke. The board has reviewed all the evidence in this case. We find that Dr. Marcus Webb violated the standard of medical care through gross negligence. His examination of Ms. Morrison was inadequate. His decision to forego testing was indefensible, and his decision to send her home was a clear deviation from accepted medical practice. She paused. More troubling is the evidence of a pattern of discriminatory treatment. Dr. Webb consistently provided inferior care to patients of color over a period of years. This is not only unethical, it violates the fundamental principle that all patients deserve equal treatment regardless of their race. Dr. Webb sat motionless, his face pale. The board's decision is as follows, Dr. Williams continued. Dr. Marcus Webb's license to practice medicine is hereby revoked. This revocation is permanent. Dr. Webb may petition the board for reinstatement after 5 years, but such reinstatement will require completion of extensive bias training, supervised practice, and demonstration of genuine rehabilitation. Keisha felt tears streaming down her face. James put his arm around her shoulders. Additionally, Dr. Williams said, the board is sending a formal recommendation to St. Catherine's Medical Center and to all hospitals in the state regarding the need for better oversight of physician behavior, mandatory bias training, and systems to identify and address patterns of discriminatory care. Dr. Williams looked at Dr. Webb. Dr. Webb, you had a long career. You helped many patients over the years, but you also harmed patients through your bias, and Ms. Morrison nearly lost her life because of it. This board takes its responsibility to protect the public seriously. That means doctors who cannot provide equal care to all patients cannot practice medicine. She turned to Keisha. Ms. Morrison, on behalf of this board, I want to say that we hear you. We believe you, and we hope this decision brings you some measure of justice. The hearing was adjourned. As people began to leave, Dr. Webb walked over to where Keisha stood. David stepped forward protectively, but Keisha held up her hand. Ms. Morrison, Dr. Webb said quietly, I know this doesn't change anything, but I am truly sorry. I'm going to spend the rest of my life working to understand my bias and to do better. Not as a doctor, I accept that I've lost that right. But as a person, I'm going to do the work. Keisha looked at him for a long moment. I hope you do, she said finally. I hope you really understand what you did. Not just to me, but to every patient you ever dismissed because of their skin color. That's what I hope for. Dr. Webb nodded and walked away, his shoulders slumped. Outside the building, Keisha breathed in the warm summer air. She felt exhausted and emotional, but also something else, something like peace. It's really over now, James said. No, Keisha replied, a small smile forming on her face. It's just beginning. Over the next 6 months, Keisha used her settlement money to establish the Patient Advocacy Foundation for Healthcare Equality. She partnered with hospitals to develop training programs on implicit bias. She created resources for patients facing discrimination. She traveled to medical schools, telling her story to future doctors. Sarah Chen, the nurse who had testified, joined Keisha's organization as a coordinator. Together, they developed protocols to help medical staff recognize and interrupt their own biases. St. Catherine's Medical Center implemented sweeping changes. They hired a director of health equity. They created an anonymous reporting system for staff to flag concerning provider behavior. They made bias training mandatory for all employees, from administrators to janitors. Most importantly, they installed patient advocates in the emergency department, trained staff members who could intervene if patients felt they weren't being heard. 1 year after her surgery, Keisha was invited to speak at a national healthcare conference. She stood on stage in front of hundreds of doctors, nurses, and healthcare administrators. I'm not special, she told the audience. What happened to me happens to black women every day in this country. We go to the hospital in pain and we're not believed. We ask for help and we're dismissed. We lose organs. We lose lives. We lose trust in the medical system that's supposed to protect us. She paused, letting her words sink in. But we can change this. Every person in this room has the power to make a difference. Listen to your patients. Believe them. Check your assumptions. Ask yourself, would I treat this patient differently if they were white? Be honest about your biases and work to overcome them. Keisha looked out at the sea of faces. A doctor's prejudice almost killed me. But it didn't, I survived. And I'm using my survival to make sure fewer people have to go through what I went through. That's my purpose now. I hope you'll join me in this work. The audience stood and applauded. Many people were crying. After the speech, a young black woman approached Keisha. She was in her first year of medical school. Thank you, the student said. I needed to hear your story. I'm going into medicine because I want to be the doctor who listens, the doctor who believes, the doctor who treats all patients with dignity. Keisha hugged her. Then you're exactly what we need. That evening, Keisha returned to her hotel room and called James. I miss you, she said. But I think we're really making a difference. I know you are, James said. I'm so proud of you. Keisha touched her abdomen where surgical scars still marked her skin. She had lost an organ. She had lost the chance to have the family she planned. She carried trauma that would never fully heal, but she had also gained something, a purpose, a voice, the power to create change. She thought about Dr. Webb somewhere out there without his medical license, hopefully doing the work to understand his bias. She thought about the other patients who had come forward with their stories. She thought about the medical students who were learning to do better. Change was slow. There was still so much work to do. But it was happening. Hospital by hospital, doctor by doctor, patient by patient, things were changing. Keisha opened her laptop and began writing her next speech. She had been invited to speak at 3 more medical schools. She had meetings scheduled with hospital administrators. She had patients reaching out, asking for help, advocating for themselves. The work was exhausting. The memories were painful. But Keisha knew she was making a difference. She was turning her trauma into action, her pain into purpose, and that, she decided, was its own kind of healing. Outside her window, the sun set over the city. Keisha watched the sky turn gold and orange, and she felt something she hadn't felt in a long time. Hope. Hope that the medical system could change. Hope that future patients would receive the care she was denied. Hope that her daughter, if she was able to have one someday through adoption or other means, would live in a world where black women's pain was taken seriously. It was just hope. But sometimes hope was enough to keep going. and Keisha was absolutely going to keep going.